Should you use a cervical collar in managing a case of cervical radiculopathy? There is a randomized controlled study that attempts to answer this question that may have missed your radar. The title of this publication is Cervical Collar or Physiotherapy versus Wait-and-See Policy for Recent Onset Cervical Radiculopathy, Randomized Trial. This study was published in the British Medical Journal in 2009. You may recall around 1995, the evidence for the use of a cervical collar in the management of acute whiplash patients came under attack. There was no evidence that soft or hard collars immobilized the spine, and the outcomes didn't seem better for those using a cervical collar. Adding to the concerns about their use was that doctors feared that patients would adopt a sickness behavior if they wore a collar too long. Note, though, that this and other studies were related to whiplash injury. With regard to radiculopathy, several randomized studies demonstrated no advantage to the use of a cervical collar or physiotherapy in patients with chronic cervical radiculopathy. The study we will discuss focused on a patient group that surprisingly had not been studied: patients with acute or subacute cervical radiculopathy. You recall that there are basically three types of cervical braces or collars. A soft collar probably serves as more of a reminder to not move the head and neck, but does not provide any significant restriction or support. There is the hard collar, which is more restrictive, and then finally a semi-hard collar. Clearly, the semi-hard collar is more comfortable than a hard collar, and given there is no evidence of additional immobilization, most doctors prescribe a semi-hard collar. To study the value of a cervical collar, the researchers felt it was important to address the concerns of dependency on the collar, compare the opposite approach of being active and exercising, and then to compare these two groups to patients who did nothing to see what natural history reveals. Findings from prior studies and this study agree that at 6 months, most patients are pain-free, regardless of what is done. Other studies indicate that improvements from surgery are in the short term better, but lost at 2 years. So who are the patients? The inclusion criteria enlisted patients between the ages of 18 and 75. Symptoms were less than 1 month, arm pain on a visual analog scale of 40 millimeters or greater, radiation of arm pain distal to the elbow, provocation of arm pain by neck movements, sensory changes in one or more adjacent dermatomes, and diminished deep tendon reflexes in the affected arm, or muscle weakness in one or more adjacent myotomes. Exclusion criteria included clinical signs of spinal cord compression, previous treatment with physiotherapy or cervical collar, and insufficient understanding of the Dutch or English language. After the patients were selected, there was a total of 205 patients with symptoms and signs of recent onset cervical radiculopathy. They were then randomized into one of three groups: a cervical collar group who wore a brace for 3 to 6 weeks with gradual weaning off of the brace during the last 3 weeks and taking as much rest as possible; a physiotherapy and home exercise group with a total of 12 treatments, 2 per week for 6 weeks, or a control group who continued daily activity as much as possible but received no treatment. Let's look into the detail of how each of these three groups was managed. For those with a cervical collar, they were fitted with a semi-hard collar, specifically a Cerviflex S by Bauerfeind. They were instructed to wear the brace during the day for 3 weeks and to rest as much as possible. Through the remaining 3 weeks, they were asked to wean themselves off of the brace, and at 6 weeks, to not wear the brace. They were instructed to keep a diary of how long they wore the brace each day to determine compliance with the prescription. The physiotherapy home exercise group met with a physiotherapist twice a week for 6 weeks for hands-off sessions focusing on self-mobilizing and stabilizing of the cervical spine through graded exercises to the superficial and deep neck muscles. The patient was instructed by the physical therapist in home exercises. They instructed the patient to practice these daily and to record the amount of time exercising in a diary. There were 2 primary outcome measures: changes in pain scores for arm and neck pain on a 100 millimeter visual analog scale, and changes in the Neck Disability Index during the first 6 weeks. Secondary outcome measures included treatment satisfaction measured with a 5-point scale, with 5 equaling unsatisfied. Also, the use of opiates and work status were recorded. Outcomes were taken at baseline, 3 weeks, 6 weeks, and 6 months. The results? The improvement for arm pain and neck pain were calculated separately. The improvement was looked at per week and also the total improvement over 6 weeks. Differences between both treatment groups were similar and were compared to the wait-and-see control group. Let's look first at arm pain and then neck pain. For arm pain, the wait-and-see control group improved about 3 millimeters per week on the 100 millimeter VAS for a total of 19 millimeters decrease in arm pain at 6 weeks. The two treatment groups, though, improved more rapidly and at 6 weeks had an average decrease of about 31 millimeters on the VAS, an additional 12 millimeters decrease. For neck pain, the wait-and-see control group improved only 5 millimeters at 6 weeks, whereas the two treatment groups improved on average between 14 and 17 millimeters on the VAS at 6 weeks. That was an additional 9 to 12 millimeters. Interestingly, there were no differences among the three groups for satisfaction, which ranged between 54 to 59%, not very high. Also, the use of NSAIDs was similar among the three groups. Work status did not seem to be different either. Most importantly, there were no differences among groups at 6 months follow-up. Let's review then the key summary points about this article. Patients with cervical radiculopathy experience significant pain in the first 6 weeks of onset. The most severe pain is in the arm compared to the neck. The results of this study of acute and subacute patients with cervical radiculopathy demonstrated that the use of a semi-hard collar is a valuable option for beating natural history at 6 weeks. Also, keeping the patient active with self-administered mobilizing and stabilizing exercises is equally effective. Given the evidence for manipulation in cervical radiculopathy has not provided a clear picture of its value and safety, these two options should be considered.